Afternoon, and welcome to our today's presentation. My name is Lucia Quigley. I am the account manager for GARMI for all Georgian at ILAC students, and I welcome you today to hear the information session about your healthcare plan. As you are about to start your new adventure here at Georgian at ILAC, we hope that you have a safe and healthy experience. However, if you become sick or injured, just make sure that we are here to help you. And GARMI is your emergency healthcare plan for any new and emergent illness that will happen to you. How you access your healthcare access card, how you access your insurance is through this card. We call it the HAC, H for healthcare, A for access, and C for card, the HAC card. And you will receive this card via email to your Georgian email account. Just make sure that when you receive the email, you download the policy, you print it so you have a hard copy and a soft copy. Also take a picture of the card so you have all the information in many devices as possible, because you will be referring to this information throughout your stay at Georgian at ILAC. This is a sample of the welcome email that you will be receiving. Make sure that when you do get the email, you follow the instructions listed in the welcome email. You have to click, you have to download, and you have to open your GARMI account where you can access all this information. As you can see, there's emergency assistance numbers here. Just make sure that if you have any questions, you reach out either to the contact at Georgian and ILAC, or you can reach out directly to GARMI if you have any technical difficulties. We're here to assist you. It's important that before I go into the details of the policy, that I mention that the costs associated to seeking medical assistance in Canada are very high. This is not to stress you by any means, it's just to make you aware that from an ambulance service to an ER visit, there is a lot of money involved into these services. However, GARMI will cover you if you need to get and seek medical attention. So make sure that you have the phone numbers ready to call us if you need to head to the hospital, for example. It is very important that GARMI is notified that you are being admitted to a certain hospital, so we can make the arrangements with the administrations of that hospital, so you don't have to pay for the visit yourself. Also, and this is very important for me to tell you, before you go into any expensive testing, whether it's an ultrasound, x-ray, MRI, CT scan, make sure that you call our claims team, our customer care team, because you will need pre-approval for these procedures. These procedures are not direct billed, meaning you have to pay and then you claim the money back. And always make sure to bring your GARMI card, photo ID, and money to pay for the visit if the clinic is not part of our network. So that's very important for you to know. The policy that you all have as international students at GARMI at ILAC is the GARMI More Canada Enhanced. And it has a wide range of coverage. It's a $5 million policy available to you from hospital, physician surgery, any diagnosis testing, prescription, psychotherapy, ambulance, dental accident. If you have to go to the States for a short trip, no more than 30 days, you are covered in the States as well. Family transportation benefit if you are in a hospital in a bed rest and you're required to have a family member to be with you at that time. All those new emergent injuries and illnesses will be covered, as I mentioned before. This is not a policy that will cover you for something that happened prior to the start date of the policy. It is a policy that will cover you for something that happens while you are attending school. So always make sure that you check the policy wording for the terms and conditions. You can find these documents in the customized site. And always check the start date and the end date of the policy. It's very important. There are some exclusions in the policy, so make sure that you read them very carefully. Any treatment that is not medically necessary, that you is considered elective, maybe your doctor back home said, oh, since you are there, just check this or check that, or those a doctor will assess, and if it's not medically needed, will not be approved. Also, no prescription medications. Anything that you can grab out of a shelf and pay for it at any pharmacy or store will also not be covered. If you had any expenses in your home country, those are not covered either. And also, if you are participating in a professional sports or any motorized contest of speed, as well as operating any type of aircraft or traveling as a passenger or on any non-commercial flight. For example, if you are driving an Uber or any other way of transportation, that's also not included if you get into an accident. So please make sure that you read the policy, both what includes, what covers, and what is excluded from it. This is going to be the website where you have all the information listed, compiled. The hub of information for your policy is www.guard.me/Georgian. So make sure that you visit it and you get familiar with the site. In here, you can download your policy documents. You can open the Garmi account. You can open the mobile doctor account as well. So have a look at it. It's very important. And the reason why I am referring to this is because this is tidying up to the last piece, is where do you go when you are sick? The first approach, the first step you should do is always call mobile doctor. So hopefully once you receive your policy online via email, you will open the mobile doctor right away. It is in order for you to open the mobile doctor, you need the policy number and your date of birth. And mobile doctor is available 24/7 in Canada, and treats most of the symptoms that might happen to you while you are attending a school. Doctors can prescribe medicines. It's very convenient, in my opinion, saves you time and energy, especially when you're not feeling well. If the mobile doctor cannot assist you, the walk-in clinics are also available. Make sure that you go to a walk-in clinic that is part of our network, so you don't have to pay for the visit. However, you are welcome to attend any walk-in clinic that is convenient for you. Just if you pay for anything out of your pocket, make sure that you keep the receipt. I always recommend that you take a picture of the receipt in case you have to submit a claim. Then the money can be refunded to you. Hospitals, we are leaving the hospital service or availability for those emergencies. If you cut yourself, if you are bleeding, if you're in an accident, a car accident, if you fainted, if you have massive chest pain, stomach pain, back pain, if you have excruciating pain that obviously is not normal and you cannot wait, of course, just call 911 and just get the help you need. But please don't go to the ER for any illnesses that could be managed by mobile doctor or walk-in clinic, because the wait time at our ER and hospitals are very long, and they might even send you back home if you are not in need to actually be there. So be aware of this. I tell you this from my own experience. My home country, if I get sick, we don't have what is called the walk-in clinics. So we always go to the hospitals when we're feeling ill. But however, this is not the case in Canada, especially in Ontario. We're leaving hospitals for people with heart attacks, delivering babies, with accidents, car accidents, and so forth. So keep this in mind when you decide where to go to get help. I want to explain a little bit more about the mobile doctor. It's a service provided by Maple, the company Maple, and is provided by Garmi. And basically what Maple through the mobile doctor does is pair you with a doctor once you connect with them online and check your symptoms. And once you are matched with a doctor, Canadian doctor, you will start communicating your symptoms and they will ask you maybe some questions, and the doctor, mobile doctor, can even prescribe the medication over the phone through a chat or computer, or by phone if they need to be maybe doing some sort of virtual checkup. The beauty of this service as well is you can get that prescription delivered to your home, so you don't even have to go to the pharmacy, or you can do a pharmacy pickup. If you decide to have it delivered to your home, just be aware that the delivery time is 1 business day, and the pharmacy pickup is the same day. Just make sure that when you go to the pharmacy you have given to the doctor, a mobile doctor, that you bring the Garmi card, so you can only pick up the card, the prescription, and then everything is done. So I will strongly suggest that you open your mobile doctor account once you have your policy number delivered to you. Uh, Repeating again, please make sure that you make this URL your favorite, because in here you are going to find all the information related to your Garmi insurance. This is when you go into the website, you will see on my account on the left side, you can find the policy documents. You log into your account. Also in the same left side banner, you can find clinics, you can submit claims, and you can find the mobile doctor tab as well. If you need to go to a clinic, a walk-in clinic, make sure that you click on the Canadian clinic and type your address, postal code, or major intersection, and it will give you a list of locations that you can actually visit. Because of the situation we're still living in, I will strongly suggest that you call them up and make an appointment, so you don't waste your time maybe showing up there and they don't have a space for you. So make sure that you have this available. Downtown Toronto, we have a lot of options available. Just make sure that you type your address. And if you decide to go to a walk-in clinic that is not part of our network, as I mentioned before, just make sure that you keep the receipt so you can submit later. The online submission is really straightforward. You go into the customer site and you are going to upload all the receipts, all the medical records given to you. And if you have any issues or need further assistance, you can watch tutorials and so forth. So the most important message here is that you keep all the receipts, so then you can claim the money back. Please do it right away. Don't wait months to get your money back. It is important that everything is sorted and submitted on time. It's very straightforward. In order to submit a claim, you need your policy number, your date of birth, and just follow the steps that will prompt the screen. Just keep in mind that a complete claim form will include your name, policy number, and date of birth. Who are we paying? Are we paying you, the student, the policy holder, or are we paying your homestay, your a relative, your significant other, or we're paying maybe the hospital or the walk-in clinic gave you an invoice and we have to pay them directly. I will strongly suggest that if you receive one of those invoices, you submit it right away. You don't want to be responsible for owing money to this facility, this provider, because the invoice will come on your name. It's not coming on Gartner's name, it's coming on your name. And please write a detailed description of your visit. Add the showing proof of payments. Make sure you sign and date the form. If you are here in Canada with your dependents, your spouse and or your children, just make sure, and just to let you know, they are not automatically covered by your policy. Your policy is an individual policy and I will only cover you. If you want to have them under Garmi coverage, you need to go to the customer site that I mentioned before and just on the left side click on dependents and you can proceed to purchase a policy for them. The cost is $1.65 per day and it will be the same policy that you have, Garmi more enhanced. So you are welcome to buy that one or something else, whatever you decide. Just make sure that they are covered. And remember that slide I showed you earlier, how expensive it is to access the healthcare system in Canada if you don't have provincial care. It is very high. So for a few $100, you can have a great coverage, $5 million and your family. So just be aware of that. If you could take a picture of this slide, it's very important. Is the emergency line where you can call us anytime something is of your you need to contact us for an emergency. For any general inquiries, please customer care at guard.me is the email that you will be emailing. If you already have your policy number, please add it, write it on the subject line so it's easy for us to find you in the system. The website is www.guard.me/Georgian. And our customer service team is available 24 hours a day, 7 days a week. So we're here to help you if you need it. Wrapping up and closing this presentation, please make sure that you check your Georgian email account to download your GuardMe policy. Take a picture of it, print it. It's always important that you have a hard copy of it. And once you have the policy number, open the GuardMe account and the mobile doctor account. As I always said, maybe you are not sick now, but what if you get sick later? You don't want to be opening these accounts and doing computer stuff when you are feeling ill. Take a picture of any medical receipt or expense that you go into so that you can submit the claim later. Save the guard.me/Georgian as your favorite site. And please, if you have any questions related to your policy or any other, is this covered, is it not covered, email us at customer care at guard.me, write your policy number in the subject line, and our team will be happy to assist you. And that concludes my presentation. I will thank you for your time and enjoy your stay at Georgian at ILAC. Take care.